Welcome to the Smith Physical Therapy Plus Education Series. My name is Dana Truss. I'm a physical therapist here at Smith PT, and we are putting together a whole series of educational videos about different topics that our fantastic team of therapists love to treat. And our guest today, who a lot of you probably already know, is Megan Long. Megan, welcome.
Thank you. This is so fun. I'm so excited to share our knowledge with everybody.
Well, I'm excited to learn more about this stuff.
This is good.
Because yes, your world is so different from mine.
Yes, and it's definitely a hot topic when it comes to dance medicine. So it's great.
Can you give us a little bit of a background about your experience as a PT?
Yeah, so this year I will have been a physical therapist 20 years, which is crazy. In addition to that, I have always loved treating dancers. I was a dancer myself since I was like 4 years old. And then after that, I went on to teach for almost 25 years. So I have that dance teacher background as well as being a physical therapist. And then there's so many continuing education classes out there. So I've taken a lot of dance specific courses about the foot, the ankle, the hip, all the important things that dancers need to stay healthy. So I have that background, and then also I have 2 kids that dance. So then I also have the perspective of a dance mom, as well as a dance teacher, as well as a dance physical therapist. So you kind of get a lot of different hats for me, which is, I think, very useful.
That is super useful, and you've done such a great job putting together our dance medicine program here, and we see so many dancers. And so I want to talk about some of the things that you see with your clients. And I think, first of all, like, why would, we could go to any PT, right? So why would a dancer who has an orthopedic injury want to work with someone with as extensive of a dance background as you have?
Yeah, I think it's the same as why a baseball player is going to want to see an overhead athlete specialist. So dance is very unique as a sport, and there's a lot of demands and expectations for a dancer. So when a dancer comes to physical therapy and having a therapist that understands what a batma means, and not having to explain that to a front kick or a side kick, it's just a lot more reassuring to them and the parent that I know where they're coming from. So I think that we have the ability to know the skills, we understand the demand of dance and what they need to get back to. Yeah. So I think it's a great experience for them. I help them try to feel like they're staying in the studio as much as they can with our dance space that we offer them as well.
I would also think too, because you have that instructor background, you know how to teach movement.
Yes.
And so then you can apply physical therapy to how you would teach that movement too. And I'm not a dancer by any means, so this is all new information to me too.
Yeah, and we definitely do that, and we also will video them doing the dance movements, because I do know what to look for proper turnout and what that skill is actually supposed to be looking like. That then I can kind of go through them as a dance instructor and show them that, as well as asking them what common corrections they get from their teachers. Okay. Because I know that that's a big thing. So if I hear their teachers are always correcting their turnout, I'm going to look at their turnout as well.
Okay. It's so nice to collaborate with everybody on those cases. Yes. So today, there's so many things that we could talk about, so we'll have to do this again. But today, we know that dancers have tons of different types of injuries that can come up, but let's talk about the foot and ankle more specifically today. So are there common things that you see in your dance population with, like, 3 most common foot and ankle injuries?
Yeah, I would say right off the bat, we have the common ankle sprain. And then with dancers, we tend to get into tendinitis. One of them specifically is called the flexor hallucis longus tendinitis, because there's a lot of pointing involved with dance, and that is a muscle group that helps with that. And then lastly would be probably like impingement, which is something we can talk about later, but that's another common thing for point shoe dancers as well.
Okay, so let's talk about each of these a little bit more, because I think some of these are definitely terms that most people don't know, but I think something that's common out there are ankle sprains. For people who aren't in general familiar with an ankle sprain, would you mind explaining what that is?
Sure. An ankle sprain is typically, you can roll your ankle out or in. Typically, it's when we roll that outside of our ankle onto the ground, which is called an inversion sprain. And when we do that, we are disturbing the ligaments and the tendons that are on the outside of our ankle. So a lot of times we can have a sprain where we're just tweaking those ligaments, all the way to a high severe sprain, which could have some tearing of that ligament. And then we also have to look at all of those muscles that go along the side of our leg as well, because they can get strained as well when we do those ankle sprains.
Sure. So we can see those in any population, right? We could step out our front door and sprain our ankle. Not speaking from experience, but with the dancers, are there specific movements or techniques that they do that put them more prone to sustaining an ankle sprain?
Yes. And right now, dance is just becoming more and more competitive and new and harder skills. So I think a lot of times if I see an ankle sprain, they have been trying to master some of the new acro skills. So some of these flips that they do, but otherwise it's a lot of times pirouettes and fletes, which are turning, and they'll come down just slightly wrong in between turns, which might have them roll their ankle. Also landing hard, challenging leaps. If we land just slightly wrong, the amount of force coming down out of a jump can cause us to roll that ankle. But I do, for the most part, see these happening with the reoccurring story of it was my last run through of the dance. I had a 4-hour practice. So a lot of times it happens when those dancers are starting to get fatigued.
Okay. Are there signs or things that they should look for if they're starting to get fatigued?
You know, I think
tips that you give them.
Right. I mean, I tell them, like, if you're starting to always fall, we call fall out of our turns, take a moment, maybe take a little break, make sure that we're feeling still strong enough to continue with that. Or if you have kind of a weird landing of a jump, it might be that it's time for a break.
Okay. Yeah. Good advice. Really good advice. So when someone sprains their ankle, do you find that they tend to want to just keep pushing through and dancing anyway? I know there's a lot of pressure to compete or for performances and things like that. So is that something that happens frequently when there's just something as common as an ankle sprain?
I think so. I think there's a lot of pressure on themselves as well as like pressure, from wanting to support the team. So a lot of times I think they say like, well, I still finished practice and then I came home and the next morning then it was really big, So I think that they do try to kind of push through it. The problem with pushing through something like an ankle sprain is that we get that reoccurring ankle sprains, or we get more severe injury as a result of it. So I have definitely seen a lot of people that are not fresh ankle sprains, but people that sprained their ankle a couple of years ago and feel like their ankle is super loose. So
okay. So I was going to ask you about that, because dancers are so flexible and need so much mobility in their joints for what they do. Is instability a more common feature in the dance population? And does that increase the risk of these types of injuries?
I think it definitely does, because they will want to have those perfect splits and want to have those perfect leaps. So we do a lot of stretching in dance. So I think that we do get that tendency to have a little extra mobility. The nice thing with the ankles is a lot of studios do a lot of strengthening classes for the foot and ankle to try to prevent these from happening.
That's great.
Yeah.
Is there something, and we've talked about this a little bit, but specific movements that you've seen that result in these ankle sprains?
I mean, I think it kind of comes back to like the turns and the leaps. But it's just going to be as they're learning new skills, is when they start to learn those new skills, we really have to break it down and make sure that they have the stronger enough hips so that when they're landing, they have that support, and is their core strength good. So we get excited to do skills, but I think sometimes that's when we see that uptick in injury, because they really were hoping to nail that one move, and then unfortunately they roll their ankle on it.
It's interesting that you mentioned that too. So it's important to keep in mind in the background of all of this, right? Is that sometimes maybe an ankle sprain is really a symptom of some other problem that we have to investigate, which is something that you're so good at looking at. So yeah, another reason to work with the dance medicine.
Yes, we definitely do not just treat whatever they're coming in for. Like if you're coming in for the ankle, we are going to look all the way up the chain, because we don't just dance with one leg, we dance with our whole body, and making sure that we have the right flexibility and strength throughout the whole body.
Sure. So you had also talked about these recurring ankle sprains, and I think people initially will try and just manage it themselves because it is such a common injury. When it becomes this chronic problem, or years have gone by since the initial injury, you talked about a tendinitis earlier. Does this recurring ankle sprain situation lead to tendinitis, or how does that develop?
I mean, it definitely can, depending on those muscles that are along that outside of that ankle. Okay. So if they're always rolling it, then that muscle isn't maybe firing as well as it should be, and that can lead to that. The tendinitis is we see over time where we're still having the pain. We have to look closer to see like what is causing the pain.
Are there symptoms that you look for that would help you differentiate between, or help someone differentiate between an ankle sprain and a flexor hallucis longus tendinitis?
Yeah, I mean, I think a sprain, you're going to have the story of like, I rolled it, something more traumatic. And then it's going to be kind of sharper pains initially, and then the swelling. And then with the tendinitis, it kind of just gradually builds and you start to have this dull aching pain that is kind of always there. With certain movements, such as like for the flexor hallucis longus, if we're pointing, then that might aggravate that symptom more. And that's going to indicate to me maybe it's more of a tendon because it's during an active movement versus just a position, which might be more that sprain.
Okay. Is there a location in the foot and ankle where you would notice those tendinitis symptoms more with the FHL?
That one's going to be more kind of that inside of that ankle.
Okay.
And kind of in that arch in the bottom of the foot.
Okay.
So if they're saying like when I point my foot, it hurts, that's going to be more of that flexor hallucis. If it's more on the outside of the ankle, then most likely that's from like an ankle sprain. And I would investigate, have they had any sprains recently?
Okay. And then does this develop into the third thing that you brought up? Like, does this just keep building on each other, right? But we develop, this now turns into an impingement problem. So is that how the progression kind of goes? Or is it a separate issue?
A lot of times it can be a separate issue. With the dancers, I see more posterior impingement, which is going to be kind of hooked in the back of that ankle. Sometimes they even think it's like an Achilles tendinitis. And that is just when, you get that inflammation in that tendon area and then it's getting kind of caught, whether it's under soft tissue or maybe caught on that ankle bone. So then when we're doing movement, we kind of get more of a pinching sharp pain with that. And then we have to kind of look at, okay, what is the reasoning? Is there some structural issue that's pinching it? Is there a strength thing as well involved? And we have to calm down the inflammation in there.
Structurally speaking, then where would you tend to see that impingement happening?
The impingement you're going to see more in that back of the ankle. So kind of pinching by like your Achilles and behind that ankle bone.
Okay. And then again, are there different techniques or things that and movements that dancers do that put them more prone to an impingement developing?
For impingement, I see it a lot with our point dancers. With point, there's a lot of force that goes through our feet. It's not just our body weight. When we're in point, that's putting exponentially more strain and weight on our feet. So that having to hold them in those positions, in those tighter shoes, that's when I tend to see those impingements because you're long hours on your toes.
Because of the constant demand on the foot and ankle through dance, I know the last thing that any athlete, dancers included, the last thing that they want to do is stop participating in their sport or their dance. And so what kinds of things are they able to still do? Like, do they have to stop dancing completely with these types of foot and ankle injuries, or how do we manage that?
It will depend on the severity. If there's a severe ankle sprain that does involve some tearing in there, then yes, there might be a short period of time where they have to modify. My goal always is to keep them in the studio. So if it is an ankle sprain and they're in a boot, there's no reason why they can't be still going to the studio to learn their combinations and then do upper body. And then they also can be doing their physical therapy exercises at the studio. But it's very important to stay in the environment just so that you do not have that emotional disconnect. And there's so many other ways to stay strong. So we always try to modify. If it's a less severe injury or like the impingement is feeling better, then we get them back into bar work, but we avoid things like releves and jumping. So things like that we just modify what they're doing, but that they're still able to go. And there's something called marking your dance, which means you're not doing things full out. And we a lot of times are able to still communicate with their studios and say, hey, they're going to be there, but they're going to have to mark their dances a little bit.
Okay.
And I think that gives them a really good outcome for success, because then they're not feeling that disconnect and getting back in there and struggling with other endurance issues.
Yeah, it's so important to stay in it as much as you can. So it's nice that there's ways to adapt
Yes.
with these ankle and foot injuries too. As a PT, what do you do to treat these people? What are the techniques and things that you use?
Yeah, so as a physical therapist, it depends on what the dancer's coming to me for. So if they are coming from, say, an ankle injury, then we do, formal physical therapy where we're working on them. We do manual therapy, which might involve cupping, might involve Graston, things to help improve that tissue mobility. And then from there, we do exercises, but we very much make it dance specific. So instead of just, you know, a TheraBand exercise, we're describing that with like, this is going to help us get back onto our point shoes. And we do positions that are very similar to dance. So we're balancing, but we're balancing turned out in like a passe. So it's important that we do that. So that's what we do if they're coming to us for an injury. If they're coming to us because they're constantly getting corrected for their turnout or always bending their knee in a leap, we have a dance medicine program where we can just work on those technique training. And we can do videos and kind of look at where their leaps look like. And then from there, figure out, is there a core strength issue, a flexibility issue? And then we give them an exercise program that they work on that they can then apply in the studio as well. So we have these two nice programs that it can be PT or just more technique training.
So much variety and things that
Mhm.
you can do with them.
Yes.
I think that's fantastic.
Mhm.
So thank you. I learned a lot about ankle and foot injuries. And
It was
dance
wonderful, and
population.
hopefully everyone else did too.
Yeah. Thank you for joining me.
Thank you. See you guys next time.
Yes.